If you're suffering from neck pain or cervicogenic headaches, there are two surgical interventions that might be for you. One of them is a cervical discectomy infusion. The other one is a cervical discectomy, removal of the disc, and arthroplasty, artificial disc. They're two separate modalities with good results both, but they're slightly different. In the fusion segment, you remove the disc and you fuse the two vertebrae together. It's very effective. It's minimally invasive. Most of those procedures are performed as an outpatient through a very tiny incision in the front of the neck. With cervical disc replacement, the procedure is almost identical. However, at the end of the case, instead of fusing it, there are now artificial discs that have been manufactured especially, and that artificial disc is introduced into the disc space. The artificial disc is designed to be hypermobile. To allow normal range of motion of the cervical spine. So how do we choose between one and the other? Well, much depends on the overall state of the spine. If the spine is very arthritic and the joints in the spine are already very far gone, oftentimes putting an artificial disc in is not optimal because the artificial disc being hypermobile, it may actually increase the level of pain coming from those joints. So a fusion in that case is indicated. However, in young patients, especially those that have normal neck joint, an artificial disc is probably the way to go. It reduces down the line the risk of adjacent level disease, which is developing of further disc degeneration of the cervical spine, and it may reduce future need for surgery. So we have two ways of treating this disease in the cervical spine. Both are minimally invasive, both are very successful. If the correct intervention is applied, we get amazing results. If you're experiencing neck pain or cervicogenic pain, visit the link in the bio.